So in New York and Beverly Hills, we have award seasons. And these happen several times a year in LA. And you see everybody coming in for the Emmys. The Oscars is huge. MTV Music Awards, you see it for every possible award ceremony. They're rushing in to do Botox and fillers. That's the most common. And things that will make them glow on the red carpet. So they do facials. That's the most common thing we see. Chemical peels, Clear and Brilliant, which is a laser that you do on the face, Botox and filler to make them look ready for photos and photograph very well. The other thing you see is people coming in too late, just like their weddings. When they come in and it's their child's wedding and it's in 3 weeks and they want to do a surgery that needed 3 months of healing. So every other year we see them come in before the award ceremony and say, my neck is bothering me, what can I do? I say, well, you only have 2 months left, it's too late. I'm not going to do a surgery on you and risk you looking strange for that. But I'll do a skin tightening on you. So I do Profound, which is the best skin tightening device that has ever existed in the history of the world. It's a radio frequency device that tightens the skin. They start looking good in about 3 to 4 weeks, so at least they get some benefit from that. And then I do a little Botox filler and I send them to my esthetician to freshen their skin. They look amazing. This year is different, and this whole past year, when people have events, they've actually known about it, and now they have time where they come to me 6 months before. And I do a neck lift, I do a weekend neck lift, which is an internal neck lift, or I do a facelift, I do upper eyelids, I do things that make them look sparkling and fresh. The upper eyelids change them completely. I could also do something medical for them where they have ptosis. Ptosis is a drooping of the eyelids, which you see in a lot of actors. One side goes down or both sides go down and they look sleepy all the time. So they usually use eye drops for that when they're going into the award ceremonies to open their eyes and make it look white and big. But what I do is a procedure called a ptosis repair. So I go inside the eye, I trim the muscle and I actually open the eye more. I've seen a lot of actors that I grew up with, watching them on TV, thinking they're the coolest guys in the world, coming in now in their 40s, in their 50s, and their 60s. More than I ever could have imagined this past year to come do neck lift surgery. More and more I'm seeing those patients are comfortable because they see how natural it looks. Unfortunately, a lot of the actors in the past have just gone to people who are recommended to them through their friends. And your friends don't always have the best taste or the best knowledge, and they're the ones who end up in the news for looking different, for looking fake, and some people, it ends their career. If you look at Lady Gaga in the movie she just did recently with Bradley Cooper, A Star is Born, it's an incredible movie. It's her most important role of her entire life. And the entire time, I'm looking at it, and anybody who knows lips, that she just looks ducky there. And it's unfortunate because she has nothing else done to her face. She's so natural, and she probably had her lips filled maybe 1 time or 2 times, likely with Juvederm or the wrong filler, and it just came up here and she looks like a duck. And the whole time it's distracting away from how beautifully she sings. When they're doing the close-ups, all you see is this. As far as Hollywood actors goes, there's always question as to whether or not they're doing Botox, fillers, hair transplants, and surgery. I would tell you, except for a very few character actors, very few, all of the rest of them are doing things. They're all worried now about Botox, number one, more than anything, just like they're worried about their hair and they're worried about their weight and their physique and exercising. They want to maintain and look good. So it's natural to want to do Botox or a touch of filler, but they're worried to look different. The character actors who are the older type of Al Pacino and those kind of guys, they don't want to do it. Joe Pesci, I don't know if you remember, he did do a facelift. He did one when he did My Cousin Vinny, the movie, and you can see he filmed right afterwards because he still had the bumps in his face. So these men, they do it, they just hopefully do it well. There are other men who do it, like Sylvester Stallone and John Travolta and Mickey Rourke. These men have all done it, and some have done it very well, some not so well. And then you see it. So I always respect the ones who either do it well or don't do anything at all.